The meeting will come to order.
I'm going to hang out with you guys.
That would be a good thing.
It looks
We are now holding our regular scheduled meeting held March 10th, Tuesday, 2009, 9 o'clock in the morning. At this time, I'd like to call on Father Tree from St. Helen's Catholic Church to give the invocation. Father Tree, please rise. And the invocation, or the Pledge of Allegiance, will be given by Commissioner Flesher. Come on.
Let us pray. O powerful Father, God of goodness, you provide for all your creation. Give us an effective love for our brothers and sisters who are suffering from lack of food and jobs and health care. Help our government leaders, especially here in our county, so that they do all they can to relieve the people anxiety, that they may always serve you with carefree hearts. We ask this through Christ our Lord. Amen.
Amen.
Thank you, Father. Please join with me in the Pledge of Allegiance to our great nation.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Commissioners, are there any additions or emergency items? I'd like to add an emergency item, if I could, just to get a presentation about the 66th Avenue project from the legal department, if I could. I know that we were supposed to have those items on the agenda this month or this week, and they weren't. So, if I could add that, if no Commissioners object.
See if we can get an update.
All right. Yes, and that could be under my matters.
Could we have that a little sooner, maybe after consent agenda,
I'm good with that.
Mr. Chairman?
Sure, I'm good with that. I didn't give me an inch. I didn't want to take a mile, but
I see there may be some affected parties in the
Sure.
audience, and maybe we get that out of the way early.
okay. Do that
Chairman?
after consent. Yes, sir.
The only thing I'd like to add is that Mr. Granzi is back in the chambers, and we welcome him back.
Absolutely.
Great to see you,
Yeah,
Jim.
you were a showstopper last week.
Yeah.
Good. Glad everything's going well.
First time that the chairman allowed the meeting to wait a few moments. Welcome back.
And we can't afford very many moments.
More long meetings, huh? Anything else, Commissioners?
Move to approve as amended.
Second.
Got a motion to approve the agenda from Commissioner O'Brien, seconded by Commissioner Solari. No discussion. We'll vote. All those in favor say aye.
Aye.
All opposed, nay. Motion passes unanimously. Next, we'll move down to, there are no proclamations or presentations. Now we'll entertain a motion for the minutes.
Move approval of minutes of December 19 and the regular meeting January 13, 09.
We've got a motion for both sets of minutes from Commissioner O'Brien and a second from Commissioner Flesher. And no discussion. We'll vote. All those in favor say aye.
Aye.
All opposed, nay. Motion passes unanimously. The information items you see there in front of you. At this time, we'd like to, it's been requested by the legal counsel to pull from consent for separate discussion, item 8C, which is the right-of-way acquisition. Is there anything else anybody'd like to have pulled from the consent agenda, Commissioners?
Yes, Mr. Chairman, I'd like to pull 8A.
Anything else? Seeing none, I'll entertain a motion to approve the consent agenda as amended.
So moved.
Got a motion from Commissioner Solari and a second from Commissioner Flesher. No discussion. We'll vote. All those in favor say aye.
Aye.
All opposed, nay. Motion passes unanimously. Commissioner Solari, we'll start with 8A.
This is a request from the Sheriff's Department to have certain fees for certain sex offenders, and one of the fees calls for a $10 for each annual re-registration, and I just wanted to see if that $10 actually covered the cost of the re-registration.
Well, I do see the sheriff and the attorney.
I see the sheriff here, but just Sheriff, welcome, and thank you for coming down the meet and being at the meetings. This is it's nice to have you here on instances just like this.
You're welcome. My pleasure. General Counsel Jim Harping.
Sheriff, well, my understanding was that you just wanted to get this fee to cover some of your costs involved in this, but I wasn't sure that $10 would actually cover the full cost of a re-registration, and it feels, to me, it just seems like it would be appropriate if the offender actually covered the full cost of the re-registration.
Mr. Harping has had some suggestions about that. One thing that we must understand is any time a movement of a sexual predator, sexual offender, or a convicted felon that moves to Indian River County, he or she must register with the sheriff's office. And commissioners, oftentimes these registrants occur at very odd hours, 2 to 4 a.m., etc. And our staff is tasked with not only taking time away from their normal duties, but in fact making copies, fingerprinting at times, and making sure that they're properly registered according to Florida statute. This request is to modify an existing ordinance or add to an existing ordinance that I believe that you passed last year, which would allow us to have what I feel is a minimal fee. And General Counsel Harpring has discussed possibly an increase of our proposed. Jim?
Yes, sir. Good morning, everyone. Nice to see you all again. In regards to the fee, last year in the calendar year 2008, we had to register, pursuant to state statute, over 800 criminal registrants. Approximately 167 of those were sexual offenders or sexual predators, which were continually obligated to keep track of while they reside in the county. The remainder were considered criminal registrants, which are felons, federal probationers, and the like, who are required to register under state statute, and we're obligated to facilitate that registration. The process itself is to some extent cumbersome in that we have to get the appropriate documentation, fingerprints, we have to get their personal information, residency information, and the like. I think the reality of it is even at the fees that we're charging right now, it would be difficult to recover the full cost in most schemes that were considered reasonable and that are in effect throughout the state. The figures that we have presented for registration, preliminary registration and re-registration are generally commensurate with the types of fees that various county commissions have passed and sheriff's offices are charging throughout the state for this particular type of obligation, which if we look at it essentially, given that it's a state obligation, it is an unfunded mandate, and I think it's definitely appropriate that we charge the fee. In regards to your specific request about the re-registration, Commissioner Solari, I think that at least in the context of the re-registration, we do have the initial registration information for that individual, so the amount of time that the re-registration consumes for the particular corrections deputy individual at the jail that's doing so is a little bit less, which is why we have contemplated that in terms of the fee. Certainly whatever fee you as the legislative body determine is appropriate is something that we're very happy to accept. I don't know if you have any other questions in that regard.
Well, just from what you said, it seems to me that the actual cost to the sheriff's office, which is then to the taxpayers, is going to be more than $35 and $10. And you said that it's a state statute, so there are three people who can pay: the state, the citizens of Indian River County, or the people who voluntarily move into Indian River County. And my preference would be that the third party, the people who voluntarily move into Indian River County after some other offense, be the people to pay. And I'd like them to pay a greater share of the cost. So, personally, I'd think more like $50 and $25, $50 for the initial registration, $25 for the re-registration, if that's possible, would allow the person who is voluntarily moving here from somewhere else to pay a fair share of the cost.
Mr. Harper, you see anything wrong with that?
No, sir. You're a legislative body. We will certainly comply with the ordinance as you see fit.
Mr. Collins, you good with that?
Well, I think the important thing is that we advertise it at the higher rate, and if there's public input that causes you to change your mind, at least we start at a higher rate and come down. We can't go the other way.
Any problems with delaying it for advertising?
No, sir. None that I can see.
No problem.
I agree with the suggested numbers. I don't even believe that that fully covers all of the validation and the enforcement costs and the checking on the registrants. There's a lot of collateral cost involved, and I believe that, I agree with Commissioner Solari, that the lion's share should be placed upon those who choose to reside here in Indian River County as opposed to the existing taxpayers.
Commissioner Solari, is that a motion?
Question
Yes.
or comment?
Hold on, let's go ahead and just see if we got it.
I'll make that motion to
Second.
raise the initial registration to $50, the re-registration to $25.
And then re-advertise.
And
We got a motion from Commissioner Solari and a second from Commissioner Flesher. Commissioner Wheeler.
Yeah, my only concern about this and the fee and charging even a higher fee than is proposed, obviously I am for not having these people come to our county, but most of them are going to come to the county anyway. And my concern is that somebody's going to say, well, I didn't have the $50, so I'll get it next week, and therefore I won't register. That's no defense for them, and they're still in violation. But the result of that violation and the result of that rationalization is that they aren't going to register when they're supposed to, and then you've got a sexual predator running around the community where you really don't know where they're at. And I think that's just a possibility of a spin-off in this. And in fact, I have no problem with the ordinance. I appreciate the fact that this is here, and I also would think that maybe in a year we should look at that and see if the stats support my concerns or don't support my concerns, and look at it a year from now.
Mr. DeBrawl.
Thank you. Bill DeBrawl on behalf of the County Attorney's Office. Commissioners, this is just for permission to advertise this. This has not been advertised already, so we're just looking for permission. That's all.
Okay.
So there's no need for any delay.
Okay. Commissioners.
One thing, if I may add.
Yes, sir, Sheriff.
Commissioners, that one part of the stipulation of probation would be to register not only sexual offenders and sexual predators, but the other folks that we are receiving to Indian River County from the Department of Corrections. So as Commissioner Wheeler, as part of your concern as a stipulation of their probation, they're required to register. So I don't feel that would be a hardship on them. And the fees are essentially a mean fee from surrounding counties.
Okay. All right, Commissioners, we have a motion on the floor to go ahead to change the numbers and advertise. Any further discussion? Seeing none, all those in favor say aye.
Aye.
All opposed, nay. Motion passes unanimously. Thank you very much, gentlemen. Appreciate it.
Thank you.
Okay, next we have item 8C that was asked to be pulled by the County Attorney's Office. Mr. DeBrawl or
Yes.
Mr. Collins.
Good morning, Commissioners. This is a purchase of right-of-way strip along State Road 60. The owners of the property, BRM LLC, contacted our offices last Tuesday and request to be withdrawn from the contract. They didn't want to go through with the contract. They claimed that they did not understand that they had a right to severance damages. However, we're still recommending that the Commission approve this matter. If you take a look at the agenda item on the agreement to purchase and sell real estate, the very last paragraph 811, states as follows: seller acknowledges receipt of the notice to owner and understands his, and it was circled by the person that signed it, his rights granted under Florida law, Chapter 73 and 74. The manager, Mr. Rick Root, Dr. Root, is experienced in this sort of thing. Obviously, it was a knowing waiver of any rights under the statute that he chose not to consult with an attorney. Therefore, what we'd ask is that you go ahead and approve this, authorize the chairman to sign it. We proceed to close on the matter. If BRM decides not to close, at that time we would come back for permission to file suit in specific performance to get them to perform on the contract as they've promised.
Mr. DeBrawl, what was it that all of a sudden turned the light on? I mean, it was nothing on our behalf. It's just cold feet on theirs.
Yeah, that's it. I believe what they did is contacted an attorney afterwards, after they had signed the contract, and that's when they decided that they thought maybe they had left some money on the table, evidently. I don't know. I have not spoken with Mr. Root, but that's the way it sounds to me.
Okay. Commissioner Solari.
If they do feel like they've left some money on the table, you can let them know from my point of view that we probably are paying too much. I had a discussion with county administrator yesterday, and the comparables are at the double traffic corner of Route 60 and 43rd, and I thought that we were being very generous with this. It was a parcel to the east on Route 60. So, you know, while I'd be happy to vote for this contract today, I don't think I'd be happy to vote for a penny more ever. So you can pass that along.
Noted. I will.
Thank you. Any other thing that y'all would like to talk? Anybody else want to be happy here? Okay. Thank you. All those, then I'll entertain a motion on 8C.
Move to approve staff recommendation.
Got a motion to approve staff recommendation from Commissioner O'Brien, a second from Commissioner Solari. No discussion. All those in favor say aye.
Aye.
All those opposed, nay. I'm happy. All right. I'm happy. Okay. Now we have the public discussion items. We have Oh,
You wanted to do your...
I did, I'm sorry, yes. Bill, while you were up here, if you could, give me a breakdown, please, on where we are with the two,
Chris, too.
And Chris, I think, could answer this a little bit better. I defer to him, and I'd be happy to answer any questions.
Yes,
as well.
Chris Moore, Assistant Public Works Director for the county. We received the scale report or corridor study for 66th Avenue, the segment between State Road 60 and just north of 57th Street, early last week. In the final version, we had received a draft version of that a month or maybe 2 months prior to that. It had been going back and forth between staff, our outside counsel, who's been chosen for these eminent domain cases. We had received comments from staff, and outside counsel sent them back to Arcadis, who had been preparing the design plans and also the corridor study. They gave us the final version of the corridor study early last week, and we had been intending to bring that to the board on the 10th, but we missed the cutoff date, which was March 4th, last Wednesday, to have the final version of the study done and the board item written. So our intention is to bring it forward. It's all been approved now. It's in the final version. We intend to bring it for the 17th.
what about the scale report also?
That is the scale report.
Okay, and the other pieces to come after that, do we really have to wait a week before we do the other one?
Well, the resolutions of necessity, and I'll let Bill speak to those since he's been handling those.
Thanks. I would encourage a week lay time so that if you recommend any changes in the corridor study, they could be brought back and approved. The other thing is, we don't know if you're going to approve the corridor study. Therefore, if we bring the resolutions of necessity at the same time, it could just be a wasted effort. So our plan now is to bring the corridor study on the 17th and the resolutions of necessity on the 24th.
I'd rather have them both at the same time. Yeah. I don't mean this in a bad way, but I don't see anybody up here changing the scale report. What's sitting up here? Yes.
Chairman, I concur with that. I mean, when this initially came before us, we were supposed to be back to some people by around the 10th or 17th of February, and it's a month later. So I don't think it costs our board any time to, if something happens with the scale report and it doesn't go through, well, then we just won't address the next matter at that meeting. But I'm with Chairman Davis. I think that the scale report will go through, and there's no reason to delay it another week.
Very well.
Okay.
So you just want us to put the resolutions a little later in the agenda?
Right after it.
Okay.
Yeah, immediately after.
Do we need any formal motion on that, Mr. Chairman? Or
If you want one,
I'll be more than happy to have got a motion to bring them both forward to the next meeting from Commissioner Solari and second from Commissioner Flesher. Any discussion?
We have a lot of folks that are in the room right now that we gave a strong commitment to that we would have this back, and back we will.
All those in favor say aye.
Aye.
All opposed, nay. Motion passes. Thank you very much.
Thank you.
Okay. Now that concludes the consent agenda and the emergency addition. Now we'll go to public discussion. We have a request to speak from Dr. Samuel Sadal, University Medical Clinics, Inc., regarding proposal for the county health care services contract. This is found on page 59 of your backup, Commissioners.
Moving right along.
Dr. Sadal, welcome.
Morning, Commissioners. Thank you for the opportunity to address you again and follow up with last week's very short.
Dr. Sadal, I'll just give you a name and address for the record as well.
Yes, indeed. Dr. Samuel Sato, 11th, my office address is 11th Court, West Vero Beach. I am one of the founders and the CEO of University Medical Clinics Incorporated, otherwise known as UMC. We appreciate the opportunity to come here this morning to share our vision and options for superior yet cost-effective healthcare delivery for the county employees and their dependents. I'd also like to introduce one of my colleagues, Mr. Joe Salentry, from our Public Information Department. My goal of this presentation this morning is to present you a snapshot of the following facts: who we are, what we do, and options for the county. Regarding company overview, I'm a board-certified cardiovascular and thoracic surgeon who's been practicing in this area since 1986. I don't have to tell you that, unfortunately, healthcare delivery in the United States today is a complicated puzzle of bureaucracy, middlemen taking their cut, and some payer like you being stuck with astronomical bills. The poor payer is also stuck in the middle, confused, often paying inordinate co-pays, high deductibles, high-cost pharmaceuticals, and very often lost through the cracks of a failed healthcare system that just doesn't work for him but against him. So in 2007, I and my family founded UMC to fill these needs. We're clearly about as local as you can get and do as much business with local companies as possible to keep jobs local and the money at home. We're offering to do the same for the county with the added benefit of helping to preserve local jobs and the tax base. Of note, 100% of our 52 employees live in the Treasure Coast, and about 50% live in Indian River County. The reason for this is that the first clinic we opened was in Central Vero Beach in December 2007, and this location still remains the center for the majority of our patient care. Regarding levels of service, I just want to be perfectly clear this morning, gentlemen. University Medical Clinics is a full-service primary care internal medicine healthcare system, and I stress system. Most importantly, we are not a traditional doc-in-a-box. What we are is a medium-sized, full-service, vertically integrated organization. We perform all the different services ourselves that are necessary to our business and necessary to your employees' health, from patient care to back-office tasks. Please let me stress, once again, we are not an HMO or an insurance company. Our mission statement involves quality of care, and it's a promise as follows. University Medical Clinics intends to make a difference in the communities we serve. Our work is proof of our ongoing commitment to our members, which extends far beyond the physical and logistical aspects of our business. From detailed planning and management to safety and environmental consciousness, we view each patient as an opportunity to excel. Our patients have a full range of traditional services available to them, including but not limited to the following: cardiology, oncology, pulmonary medicine, infectious disease, orthopedics, pain management, patient education and wellness, disease management, and diabetes management. We're proud to offer you you and your employees and our patients the highest level of service. Quality of care is the core of our mission statement. Last week I showed you briefly our Joint Commission accreditation, and I want to spend a second or two just to review this with you. I know you can't see it, but it says University Medical Clinics, Vero Beach, Florida, has been accredited. The Joint Commission, which has surveyed this organization and found it to meet the requirements for ambulatory health care accreditation program, January 5th, 2009. And this is a 39-month accreditation, which is an ongoing accreditation and is proof of our commitment to quality of care. This is the same accreditation that Indian River Memorial Hospital has, that Massachusetts General Hospital has, that Cleveland Clinic has, Mayo Clinic, University of Florida, Shands Hospital has. This is all voluntary for us. We don't do it because we have to. We have to do it because we care. And it shows to our competitors and our patients and our clients that we care and that we make the difference. So we're very proud of this, and this will go into all of our clinics. as soon as I can get it framed. The Joint Commission, as I mentioned is very important to us and important to the institutions that are accredited, because it allows them to receive federal funding from the United States government through Medicare. Without it, no Medicare funding. We have, as to locations, we presently have 6 active medical centers in the Treasure Coast, and one more that's built out and ready to open. All these clinics are ready tomorrow to accommodate you, your employees, and dependents throughout the Treasure Coast. It would take several months to increase some of our services, such as drug dispensing, but I can guarantee you that we'll be fully online with everything you require in 3 months. UMC is fully scalable and can scale up or down in multiple locations regarding the specific needs of the county and its partners. Our Vero Beach Clinic is shown here in the Fountains Medical Park on 11th Court, directly opposite the entrance to Indian River Memorial Hospital. Our Barefoot Bay Clinic, shown here, is just north of the Miko Bridge in Barefoot Bay, just north of Sebastian. Our Lakewood Park Clinic, shown here, is our newest addition, and is located on Feeder Road, just south of the county line, Indian River County line, and serves not only the citizens of Lakewood Park and northern St. Lucie County, but also serves the citizens and our patients from southern Vero Beach. We have 2 locations in St. Lucie County, 2 other locations in St. Lucie County, one in St. Lucie East off US 1, 2 in Okeechobee. The St. Lucie West Clinic is right off St. Lucie West Boulevard and is built and ready to move in. Now, we know this may not be enough to serve the citizens and the employees of the county. So we have a letter of intent to open in West Vero along the Highway 60 corridor, and that'll be opening in midsummer. We will, in addition, guarantee to expand the size, number of our present facilities, staff, and the hours of operation to include evenings and weekends to accommodate the needs of your employees. Now, we presently run a first-class operation, very high-level private practice, but with the addition of the county, we would propose, and county employees, we know how important it is for you to get your employees back to work within a short period of time and not to languish in a doctor's office for 3 or 4 hours. We don't do that anyway with our patients, so they wouldn't be our patients very long. But we will offer a so-called priority level package, priority level service package. And we understand how important it is for them to be treated well and quickly. With this in mind, the priority package would offer a dedicated staff and facilities for employees and their dependents. We can consistently provide excellent priority basic service in around 20 minutes. Many of your employees and families will also, of course, require follow-ups, and we'll take care of that. We would also consider, as we mentioned, would also consider expanding our present services to include drug dispensing, drug screening, x-ray, occupational medicine, routine physicals for firefighters and police and your employees. The real advantage in our, aside from cost savings, in our full service clinic model is that employees presenting with more complex illnesses to the priority service would be able to be seamlessly triaged over to our regular primary care staff during the same visit. And they would also be offered the opportunity to become our patients in the full scheme of things. We believe that our vertical integration of care model will result in superior service and savings of time and money. These employees and family members who should become hospitalized in the Treasure Coast would be followed in the hospital by their UMC doctor or affiliated physician. In this scenario, a UMC case manager would also follow their progress in the hospital or rehabilitation unit and arrange for home care or rehabilitation if necessary, to include making a follow-up appointment at his or her UMC clinic. The advantage of our vertical integration model is a very important facet in getting patients in and out of the hospital and rehab units appropriately and cost-effectively. Obviously, UMC, rather than the county, would assume the numerous responsibilities of building, staffing, stocking, resupplying, maintaining, and permitting the medical clinics. In the UMC model, I want to stress one thing that may surprise you. There are no hidden costs or delayed build-out costs for the county. I think I got all your attention on that one, but I won't have to repeat it. As presented, value-added benefits. As presented, UMC presently offers comprehensive adult primary care services. This also includes urgent care, gynecological procedures, and dermatology. We're not an HMO, as I mentioned, or an insurance company. We're a full-service primary care medical service organization. UMC understands the back-office aspects of what is required for being the administrator of the county's contract with Blue Cross Blue Shield. We don't want to take over and be the insurance company, but we would offer to be the administrator and cut out the middlemen and save your costs. In addition to primary and urgent care services, UMC provides our own in-house medical management, case management of institutionalized patients, risk management, referrals, insurance coding, billing, and critical analysis of your charges to help find out which charges are redundant, to help cut your costs. The large majority of our patients pay zero copay for office visits and zero copay for generic medications. As to value-added clinical benefits, UMC just doesn't stop with basic clinical services. As you can see, we offer a long list of additional services, most not previously mentioned, as follows. And I'll let you read all those here. Diagnostics, echo, we provide just about everything, many things that are offered in hospitals and diagnostic centers we offer. EKG, pulmonary function, echo, on-site laboratory services, health and wellness classes, you name it, we got it. We also offer something else that's very important, and that's a 24-hour on-call physician, not an on-call nurse, but an on-call physician hotline to help people at 3 o'clock in the morning get their medications, understand their medications, and cope with their problems to keep them out of the emergency room and save money. When I go to see patients, the first thing I ask them in groups of patients is, how many of you want to go to the emergency room? Just like you, nobody raised their hand. And then I ask them, well, how many of you want to go to the hospital? Again, nobody. And you don't want them to, and we don't want them to, and they don't want to. It's not in their best interest if they can be well treated outside and diverted. We also plan to have full electronic medical records in 2 months. Extended hours on weekends plan to start in April. Patients will be able, at that time, will be able to self-schedule their appointments via the internet. In summary, by now I think you can see that UMC is a local healthcare delivery system, mainly based in and around Indian River County, that has the size, experience, and ability to provide the highest quality, comprehensive, priority services to you all and to all of your employees of Indian River County, wherever they may live in the Treasure Coast. I noticed that 25%, I'm looking at the demographics, I noticed that 25% of county employees live outside Indian River County. Yes, access to care and employee acceptance are very important. We definitely provide that. Let me state that what we're offering is one-stop shopping as a full-service healthcare provider that can also offer back-office administrative management and cut out the middlemen to produce even better values. We will show you that a major part of your savings will also be by keeping your employees healthy and out of the hospital, thus avoiding the high cost of unnecessary emergency room visits and hospitalization. In summary, our clinical and financial team is most pleased to work with the Commission and staff to craft a strong program that will both provide easy access to exceptional care for all of you and your employees, and to reduce the burdensome health care costs to the taxpayers of Indian River County. We are presently awaiting our request for financial information from staff and would respectfully request the Commissioner's patience in granting us the time to prepare a meaningful proposal. Thank you again so much for the opportunity to share this important information with you this morning.
Thank you, Mr. Sato. Dr. Sato, yeah, I got a couple questions. First one is this seems very similar to something that we used to have called the doctor's clinic. And just so I understand what kind of facility that you have there, you could basically, in there, they had, OBs to x-rays to, just as you walk down the halls of this clinic. And then, but if that is the case, then are you currently so I know you're not a HMO, but are you on a PPO for our insurance at this time?
Yes, sir.
Okay. So that all right. And it appeared to me that the difference between what you're offering versus what that was brought forth at the last meeting is that the one at the last meeting was basically, from what I understand, to be operated almost at a nonprofit level. And anybody help me out and make sure that I'm on track with this. But just so what I'd like to do is just kind of try to understand the difference between the two, now that he's given us exactly what he does.
There's a couple significant differences, and we can certainly discuss them today, but as directed by the board on the March 3rd meeting, we were going to come back in a couple meetings. We're working on getting some numbers for the three commissioners that wanted to see some specific spreadsheets and numbers on that. But one of the main differences is, one, this would be a clinic, just like you said, it certainly cuts out all the profiteers in the middle of the game, and it's certainly a nonprofit where and a dedicated county employee health center where only county employees will go. And he had talked about dedicating some staff and some service. Well, the whole county would go directly to our health center for employees only. A couple other things, although I applaud his efforts, and he is going to try to work on putting together his drug dispensary, a drug dispensary, and be able to perform police and firefighter physicals and work on drug screening. None of that's in place now, and he can certainly try working on that. Just a brief history, City of Vero Beach has already gone out for RFP. They vetted 5 or 6 of the agencies who perform the model that we've been researching. These are models out there with proven track records of success at other governmental agencies, and those are really the models we're looking at. Although he says he's not an HMO, it's very similar to an HMO where we would pay an administrative fee and our employees would go there and there only as the gatekeeper for all the employees. You would have to go there as your primary care, where our model is going to be a voluntary clinic where the employees can go if they would like, and they wouldn't have to. They could certainly utilize their health insurance plan. The other thing we didn't hear about is I mentioned that they don't have an MRO, a medical review officer, on staff to be able to perform the CDL drug testing, which we do for obviously our CDL driver's license holders and our safety sensitive positions such as firefighters. So every quarter we're sending out probably 40 to 50 DOT drug screenings. So that would save on that. We'd be able to do that in-house. Also, the occupational medicine of our employee health center, that's going to be projected in our savings, where employees, when they're injured on the job, will go directly to our employee health center and be able to receive the occupational medicine that they need or that's required under Florida statute, and they don't have occupational med at this point. When he said that a majority of their patients don't pay a copay, that's because 90% of his patients are Medicare patients, so they don't pay the copay that way. Our setup is no employee would pay a copay for either the office visit or the prescription drug, because that would go through our dispensary and we'd buy it through a wholesaler and we'd be able to dispense the drugs. I don't know if when he said he can be a dispensary within 3 months, maybe that he can bring on a pharmacy doctor and get all the requirements on there. But when you're dealing with a company like Care Here that we've been looking at, who has over 85 clinics throughout the nation, they have all that set up. They have the medical review officer. The other thing is when we're talking about our local employee health center, we get to recruit those doctors. And through Care Here, we get to recruit the doctors, and if at any point we're not happy with that doctor, we get to say, get rid of that doctor, we want a new one in. Nobody's happy with that particular one. So we have control over the staffing, where if we contract with a university medical centers, we get what we get and we'll like it. And we probably would. No offense to Dr. Sada, I'm sure we would. I'm sure he's a very good clinic. And as he said, right now, he's currently on our PPO network. And if our employees wanted to take advantage of the services, they certainly could do that now and pay their $15 copay and use his clinics right now if they would like. So those are some of the differences. And we're certainly going to be a non-for-profit organization with our employee health center. We'll be prepared in the next couple of meetings. Assuming there's the 24th meeting, we might be looking at coming back to you on the 24th, if not the first meeting in April, with our final recommendation. Like I said, we're working on getting the numbers for Commissioner Solari. We're reaching out to Sebastian Felsmere and the others. We're hoping to be able to piggyback off the bid process that's already been done through all the governmental contracting statutes of Florida, and we'd be able to piggyback off that. So that's basically what we're waiting on, is to bring that back to the board in a couple of weeks and give you our final recommendation.
Great, thanks. One other question, Dr. Sada.
Yes, sir.
I noticed that you have one of these down in Port St. Lucie, and of course, Port St. Lucie has already one of these clinics like the county is talking about. Why aren't you doing what you're talking about doing for the city of Port St. Lucie, as you're talking about what you would like to do for us?
Well, St. Lucie already has a contract in place. The county does not. And our major interest, business interest, is in and around Indian River County. It's where most of our employees live, and we perceived that would be the greatest need for the county to concentrate on as our first effort to contract with municipalities to come here. Martin County also has an RFP that is pending, and we have interest in applying for that as well. But really, I think there's more need up here at this particular moment. Let me also say that I don't think that Jim, if I could comment on a couple of your statements. I don't think Care Here is a not-for-profit. Certainly, they're going to make money on this. We're going to make money on the contract as well. If we're fortunate enough to be granted that to work with you, but we will bend over backwards to give you as many pass-through savings as we can on drugs, drug dispensing, and all the other value-added services. We don't have 80 contracts around the country that we have to worry about. We would concentrate on this one right here in River City. This would be our beachhead, as it is with our business.
Okay.
So we're here, and
tell you what, some of the other questions.
Pardon me, sir?
Some of the other commissioners have some questions.
Yes, sir.
You may want to, Commissioner Wheeler.
Yeah, I'd just like to suggest that I think some of what the doctors mentioned I find appealing. Also, what Jim, Mr. Sexton had mentioned. And I think, first, we aren't going to make this decision here today. And I think it would be more expeditious if we were to let them get with staff, as the other company has, come back with a list of pros and cons on both companies, and at the appropriate time, get into the arguments back and forth over that and make a decision at that time rather than going through it twice.
Commissioner Solar?
Yeah, I'm feeling pretty much like Commissioner Wheeler. Most of the, we'll say, problems that Dr. Sato has at this time seem like they can be addressed. And I tend to think that competition keeps everyone on their game. I also think that having two proposals makes it easier for me to develop the right set of questions. So if it doesn't delay things too much, I'd suggest aiming for that first meeting in April, but trying to get the information to all the commissioners ahead of the normal agenda schedule, because this isn't something that I'm going to find natural to review, and we generally get the agenda on Friday afternoon, which doesn't give us a long time to review and develop questions and then ask questions. I'd like to have a few extra days to do that if possible. The only real negative I see so far in your proposal, Doctor, is the fact that it's not voluntary. And I think that we need to weigh that into our consideration along the way.
It actually would be voluntary. They would have the opportunity to come to to our medical centers or choose not if they wanted to go to their own physician.
Okay, I want to make sure, because I don't want to give up a 20, 25-year relationship with certain doctors in order to be funneled in one direction. So I just want to bring that out now.
Change the situation that currently exists. And I think what Dr. Sadal was referring to when he said that they would then have the opportunity to see our physicians is in the case of someone that came in, it was more than just an urgent care, in and out 20 minutes, that they needed further follow-up. We would have a larger staff right there that could then deal with any issues that they did have. So it's actually an expansion of services as opposed to a limiting of services.
That's fine. I just personally, I want to make sure that, well, I would want it to be voluntary and not involuntary. And Jim, when you're talking with both sets, if you can, I don't know how you can do this, but if you can try to funnel it down so they give a somewhat similar presentation, in the sense that the way they organize their numbers and stuff, to try to make it for us, for the commissioners, as apples to apples as possible, understanding that everything won't match, but
well, maybe we should clarify one thing. The county is not out to bid right now on this.
Yeah, this is no way to do this process.
Yeah,
this process is for one doctor to get up here. I think you need to send the city went out and they did their proposals and we're piggybacking. I don't think this is a way to do the process. Is have a doctor come up here and say,
here's what I can do.
Here's what I can do. If we're going to do it, we piggyback the city and we'll come back. And I think he went to the city's meeting the other day. I think you need to go through the proper process. Someone shouldn't just get on the agenda and we automatically pick them. I don't think that's it. The other thing is, he's on the PPO list and people go, I don't think we need to pay an administrative charge to go to him. And I don't think he has a network to pay an administrative charge, so I'd never recommend that. I don't recommend going about it this way, and I appreciate his presentation for your information, but if we do it, we should do it formal, and just because someone stood up today, they get picked, as opposed to everyone else who had an opportunity.
Well, Commissioners, I'm not going to entertain a motion to approve him today, so don't make one.
No, I agree with Mr. Perry.
That makes the county administrator feel better. Yeah.
No, I don't think that's going to be happening today, but I do recall the previous meeting that there was a discussion, and Dr. Sadow's presentation was to be included, and there was a discussion with Jim Sexton as well. Was that correct?
In fact, he was the only one there, yes. His doctor's group was the only one that showed up at the meeting. We met from like 3 to 5 o'clock after the commission meeting the other day, and they gave us the presentation, and then our consultant, Vero Beach's consultant, asked questions. We got the information. We haven't made any formal recommendations to Mr. Baird. We haven't met with any of you folks, obviously. We're getting our ducks in a row as per the directive of the board, and what we were going to come back at that meeting was either to recommend to the board to piggyback off City of Vero Beach's process and contract and do the interlocal agreement, or this board at that point could say, well, good luck to them, but we want to do our own process, which would mean we would then start an RFP process for our own clinic, or the board could say, we're really not interested in going into the employee health center business. We'll stay status quo, business as usual.
And I should hope that we can weigh those options, as the doctor points out, that there is no startup cost in his facility, and there is significant startup cost in the other facility as far as the partnership and the interlocal agreement as well. He does point out some very positive attributes about his styling of the clinic, and the other clinic most certainly has a long-standing, well, might have a national long-standing relationship. Some of their attributes are very appealing as well, and I just would like all of these to be brought together to assure that the doctor has a possibility of bringing some of your objections, as you pointed out, to closure. I believe that you pointed out some of the objections, but there are a lot of high points in the doctor's presentation that might be a great benefit to our government workers and the taxpayer as well.
Absolutely.
Commissioner O'Brien, you got any comments?
Yeah, just a couple things. Jim, when the city did their search, I knew St. Lucie County had been looking at this, but I'd never heard a word of the city doing it. Was this advertised? I mean, how did they do their RFP? Because it
City
sounds
of Vero
like,
Beach?
yeah.
Yes. When the Kirk Gearing and the Gearing Group was here last week, they kind of, although very quickly, they did go out to RFP. They put it out in the Vero Beach Press Journal. I'm not sure if they use a demand star like Indian River County does, where it's this big, where you put out everything out to bids, but it certainly met the bid requirements of the City of Vero Beach, and I'd have to believe it went to either vendors who had contacted them, announced in the Vero Beach Press Journal. I'm not sure wherever else they might have put the bid out, but then they received like 7 bids of different companies that offer a model, and it was a very broad bid. It wasn't who can bring me this model. It was basically who can save us some dollars on health insurance costs and get our employees healthy and focus on the health care, because that's at the end of the day what we're focused on. They had 5 bidders, went through the process, went through their board, recommended, in this case, Care Here. The board approved it, and they're moving forward. They have a facility already ready to go. It's about 2,500 square foot, maybe 3,000 square foot. I can't remember the exact square footage. We've done some site visits there. As we said, we've been working with the City of Vero Beach for several months now. Did the site visit. In fact, they're already in the process of starting the refurbishment of that recreation facility, getting the x-ray room ready with the special stuff on the walls. They're doing all that process now. And what the county obviously was looking to doing was to piggyback on them, split those startup costs, split the annual maintenance costs with the City of Vero, be able to offer more hours, more flexibility, late hours during the weekday, maybe some weekend hours. We get to set that. That's the beauty of it being our health center. We set the hours, we set the days. It's our clinic, our doctors, paid through Care Here, but there are doctors, and we get to terminate and hire who we want. Whenever we want.
Dr. Sado, were you aware of the city RFP, and did you apply to it?
No, sir, we were not aware of it, and we do business here. We were absolutely not aware of it. We came forward. We were not aware of it until last week.
That's good. Jim, I think I agree with the other commissioners. I would like to see some kind of comparison here just to make sure we are getting the best bang for our buck. And I guess one thing I liked about Dr. Sado's presentation is we have existing coverage for the South, Central, and North County. So those county workers that reside maybe in Sebastian or Palm Bay or North St. Lucie can get access very quickly. So I guess one of the questions to answer when you come back is University Medical obviously has to do some things to get up to what we want, and how much time that would take compared to how much time would it take for Care Here to get that same coverage? I mean, are they going to open more facilities so we have more convenient access to all the employees? Dr. Sado, just 2 things for you. Is one, you mentioned the Joint Commission was a 39-month accreditation, but your facility's only been open for 14 months. So I guess when you come back, I'd like to hear how you got accredited about 2 years in advance of the standard. And then secondly, you mentioned after a patient goes through the priority service, if they need more care, then they become our patient. And I guess, what does our patient mean? Does that mean a higher pay? So I was a little concerned when you said after the priority service that you're going to give the county, they then become our patient. And to me, it just sounded like a different pay scale and things. So don't want to go into all that now, but that's a question I'd like to have answered when y'all come back in April. And that's all, Mr. Chairman.
All right, Commissioners, any other comments? If not,
Mr. Chairman, I just want, well, Jim is here and the doctor's here, and I realize we're not moving forward at this point there, but I've received a lot of calls about the optional benefit that we're thinking about moving forward. And Jim, I'd like to have a brief explanation to all of the county employees that are concerned that we are looking at an option to enhance value to them as well as the taxpayer, and this is not a substitute for their medical coverage. It's not perceived as a substitute for their medical coverage, and this is not a wave of the future to provide medical coverage at a not only a discounted rate, but it would be precluded from all other medical coverage, that this is only an option. And I want it crystal clear to all of the employees.
you didn't want that today, you wanted that if we decided to move forward with this in the future?
I think he would be able to say that today.
I can give a very brief overview, and in fact, I've talked to both union presidents of Teamster and our International Association of Firefighters, both on board, think it's a great idea, because basically, as we've explained, it is a win-win. This is a situation where the county can be responsible fiscally to the taxpayers by reducing some of our health insurance costs. We're talking about a $14 million fund, and we think we can save some good dollars, although that's not exactly why we're bringing it. We believe that's the win on our side. The good side for the employees is, we've tried wellness programs, we're doing some things within the county, but we've got to do a better job. The models that are out there now, even with university medical centers out there now, is employees aren't taking advantage of getting well and taking care of themselves. It's very expensive in the healthcare market. So what we're going to be able to offer to employees while offering a savings to the taxpayers is having a employee health center that the employees can visit with zero copays, and their dependents and retirees, by the way. This is everybody covered under our health insurance plans. They can come in, see a doctor. They will see a doctor. It will not be a nurse practitioner. It will be a doctor. They can get their treatments. They can get their prescription drugs at a zero copay. I think what we can find is, and probably show, is that employees who probably have acute diseases, diabetes, and some other things, they're not taking care of themselves. It's very expensive to take care of yourself. So we think at the end of the day, we'll have an employee health center for employees to visit, save some taxpayer dollars, and they'd have all their HIPAA privacy, just like any other doctor's clinic. So we think it's a win-win for the county and the employees of Indian River County.
And emphasizing optional.
And absolute voluntary. It is not a replacement to their national network of Blue Cross Blue Shield. And just as a note I didn't mention earlier, Blue Cross recognizes the model that we're looking at, and in fact will reduce our administrative fees $4.50 per head. You're talking $1,500 to $1,800 employees, comes to around $80,000 to $90,000 a year, just in administrative fees that would be saving from Blue Cross Blue Shield, to be able to use that money towards the startup costs and other things.
Thank you.
I'd like to mention, Commissioner Solari mentioned last time when we brought this forward that he didn't have enough numbers. How I look at, we would like to do a presentation, since health insurance is probably our biggest benefit cost, to the commission to show where our trends are, like Commissioner Solari had asked for. We'll probably come back with that, a presentation on our costs and our self-insurance plan, just to give you an update, the numbers, the trends, and then after that we'll come back in a couple of weeks with this other part, because I think it needs to be a two-step process. I think that the commission needs to be updated on the cost, the trend of the cost, and where we sit nationally, locally, and everything else, because it is our biggest cost as far as benefits by far.
Mr. Chairman, I think that's a great idea. And basically, this decision seems to have only two parameters: quality of care and cost. So the better we understand that prior to the decision, I think the better result we'll get.
Okay. Thank you, Commissioner. Thank you, Commissioner. Thank you very much, Commissioner. Thank you. All right. Now that moves us to the county administrator's items, which is the citizens appointment for the Citizen Advisory Task Force. And Commissioners, do you have your board appointees to that, or County Joe Baird? You want to step in here?
I basically stuck this under my item because, and I've got Bob Keating here in the audience, each commissioner was going to recommend a member not utilizing our affordable housing committee. Each commissioner was going to add a person, and that's the only reason I put it on the agenda is because we had to move quickly with it.
Commissioners, y'all ready to do that?
Yep. Yes, sir.
Okay. Commissioner Bryan?
Ms. Kathy Thomas.
Commissioner Fletcher?
Mr. Sal Neglia?
I'm going to have Anjani Cirillo.
I have Larry Laufer.
And I have Donald Hart.
What else do you need, Bob?
I'm Bob Keating, County Community Development Director. If you can just designate those people as comprising the Citizens Advisory Task Force for the Neighborhood Stabilization Program.
I need a motion, Commissioner.
Move to designate.
Got a motion from Commissioner O'Brien, and a second from Commissioner Solari. All those in favor?
Aye.
All opposed? Thank you, Bob. Passes unanimously. And all the contact information for that, or for my contact, is, if you need the contact information, I have it.
Yeah, well, it's coming in.
You've already been in touch with Sal.
Yeah. There he is back there. How's it going, Sal?
Thanks for coming in, Sal.
All right, that concludes the county administrator's matters. Next, we have the community development, the establishment of a census 2010 complete county committee.
Mr. Chairman, we're here today asking you to create another committee. and we don't take that lightly. The good news is this is self-sunsetting. It's to last a little over a year. And this is actually, it would be the Census 2000 Complete Count Committee. And really the objective of the committee is to promote and publicize the 2010 census and ensure that all of the residents of the county are counted. It's a really important thing because the census information is used in a number of matters. It's used in federal revenue sharing. It's used for any grants that we get at the federal level, and it's also used for redistricting. 10 years ago, the county did the same thing. It established a Census Complete Count Committee for the 2000 census, and this committee would function like that committee. We're proposing that there be 15 members on this committee. There's a member from each of the municipalities, and then the rest of the members are really targeted to the low-income areas of the county because that's where it's most difficult to get people out to vote, not to vote, but to fill out their census form and be counted. We don't have recommended names to go along with the positions. What we're looking at is, I think, as typical with filling county committee positions, you could request that people who want to be on the committee and meet the geographical requirements apply to you to do that, and those specific appointments could be made in the next few weeks. Actually, during the last census, the Census Count Committee didn't meet until October the first time. So any time in the next few weeks would be appropriate to actually appoint the members. And with that, we recommend that you actually do establish this committee.
I'm assuming that we have an ordinance that from 10 years ago that created the committee of some kind, or just a motion to do?
Nope.
You just make the appointments. There's no ordinance required.
Okay.
Mr. Chairman?
Commissioner?
I'd like to make a motion that we form this committee, and I could recommend a commissioner, but if there's a volunteer commissioner, I'd add that to the motion to start off with the list.
Okay.
Anyone want to?
Before, well, you've made the motion. I'll see if it's second. I have some problems with the way it is right now.
Okay, well, I'll just leave the motion at this point that we form the committee, and then the other motion will be is whoever we select here from the board to participate.
Okay. And is that a second, Commissioner
I'll
Slaughter?
second it.
Or Commissioner Fletcher? No, for discussion?
The way that the 15 people are selected, I think that there might be actually some constitutional problems. If you take a look at the census data and try to pair it up with the representation, there are some significant problems. My understanding of it from the backup is basically the purpose of it is to get the best count of people possible. And probably you'd want to look in areas which are difficult to count to get the support, which is my understanding of why you have a heavy representative for Gifford, the Oslo area, Wabasso area, and possibly the Fellsmere area. However, you take the town of Orchid, which gets one representative, and basically with 15 representatives, that would try to match roughly 6% of the population. The town of Orchid has 0.3% of the population, and I don't think that would pass any court test. And then when you look at the people who are there, basically 406 people estimated in the 2010 census, which would roughly be 200 households, and I think we have the address of every household. I think the people that we'd have a hard time counting are the people that the source would service or some other groups would service. So, with that in mind, and with the fact that Fellsmere is also overrepresented, I'm going to suggest 3 changes. One is that we move away from the representative from Orchid and probably give that representative to another nonprofit organization. And there are a couple nonprofit organizations. One is I'd suggest perhaps the United Way be involved in the process with all their with all their complementary organizations, and perhaps another nonprofit such as the Boy Scout or some other group which might be able to be interested in this as a significant project for their organization, and an amendment to the representatives from the Gifford area where we stipulate that one of them be a member from the Pastors Association or the Pastors Association as a group. So those are 3 changes to this which I'd suggest, Mr. Chairman.
Any comments from staff?
Well, the only thing is that we were thinking that all the municipalities probably should have some representation on here, whether or not they really have people that are difficult to count or not. That's why we have Orchid on here.
Isn't the 15 a minimum?
Yeah, sure. You can
So
have
we could
more.
add. What if we added them, Commissioner Sly? If I put that in my motion, that we had your suggestions and just increase the size of the committee.
That's fine, but again, with 0.3% of the population of people who are going to have no problem to count, it doesn't seem meaningful to me. And we can easily ask the people from the town of Indian River Shores to consult with the town of Orchid.
Well, I don't think they're restricted just counting their neighborhood either. They're it's a countywide effort, and that's why the committee's made up. So, I think when they start laying out their procedure on how they want to count, probably anybody on there would be valuable, and they are municipalities, so.
That's fine.
I'll add them to if the seconds there, I'll add them to the list, the recommendations.
The seconds there, Commissioner O'Brien.
Bob, since we have the sheriff here, I was wondering if including a representative from the law enforcement would help get the word out, because the sheriff is in all parts of our county, and certainly, Sheriff, if you'd like to speak up before I volunteer you for this, but I think
that means Jeff Luther's going to be there.
Jeff, how do you feel about that?
At that address, though, they're a lot easier to count.
I think our law enforcement agencies, they get out and they might be able to find some of the homeless people and work with other agencies, and certainly with the troops on the road, they can get the word out as well, too. So, Mr. Wheeler, if you wouldn't mind adding law enforcement to your motion.
I'll add that.
Commissioner Brown, I think that's an excellent idea, because if you look at the list, the most underrepresented area of people is the people in the unincorporated area of the county, which I think the sheriff is excellently positioned to address. That's a great idea. Thank you.
Second amended.
Okay, so we've got those 3 plus the sheriff. 4th. And so not only have we successfully created the committee, we've also grown it right here
to 19 members.
Yeah, congratulations, commissioners. Yes, Mr. Mensing.
I'm on top of Fred Mensing, 75A 129th Street, Sebastian, actually in Roseland. I'm not on top of how many property owners associations you have. And we have one in Ursel Dune. We have the Friends of Historic Roseland. I think at one time you had Bureau Shores and Bureau Highlands had property owner associations, and they should be contacted to supply somebody to this committee, I would think.
Okay.
We have 100 homeowner associations out there, but I think it would be the job of this committee to contact all those homeowner associations and do the marketing. But there's probably 40 homeowner associations just in my district, so that would get kind of unwieldy. But certainly we need to contact them, and they can pass the message to their members.
Okay, we've got a motion and a second that we're going to have the committee at 19, right? That number. No further discussion. We'll vote. All those in favor say aye.
Aye.
All opposed, nay. Motion passes unanimously. Thank you, Mr. Keating.
Are we going to appoint someone from this committee to represent the commission?
Sure.
Would
Any
you like to
volunteers?
do it, or have to ask for a volunteer?
Any volunteers?
I'm going to have to do it.
All right, Commissioner Fletcher said he'd do it.
Wonderful.
All right. Okay. Next, we have the...
Gave up a committee, I'd take the committee.
There you go. Okay, now we have the Office of Management Budget request for agenda Property Casualty Insurance 2009-10 update. Jason, welcome.
Good morning, Commissioners. Thank you. For the record, Jason Brown, County Budget Director. We have before you here an RFP for insurance services for the county. Our coverage for the county's property casualty, workers' comp, general liability, auto liability, physical damage renews on April 1st each year. And what we did is this year we went out for an RFP in an effort to see if there are any other providers out there that could provide service to us and possibly provide a cost savings. We sent this out. The responses were due last month. A selection committee of myself, Beth Martin, the risk manager, and Jim Sexton, human resource director, evaluated the proposals and ranked, have a unanimous ranking for Arthur Gallagher to provide these services, continue to provide these services going forward. We have a couple items that I would like to address. One is the limits of coverage. The proposal that was submitted by Gallagher, the base proposal was a total of a little under $2 million is the premium cost. That's down from our current year cost of about $3.1 million, so a savings of over 30%. One item that I need to call to the board's attention is the limits for our property coverage are $175 million. However, for hurricanes, that's limited to $25 million. Now, they did propose additional $25 million of excess coverage at an additional cost of $437,500, and another $25 million on top of that would be available for an additional $300,000. Staff at this time is recommending the $25 million proposal. A scientific computer modeling study was done. This is what's typically done by the reinsurers themselves to assess the risk when they're generating the pricing. They have these sophisticated models. I think it's called a CAT 10 model, where they input all of the details of each building, its location, what its construction was, when it was constructed, and they run a Monte Carlo simulation and run a theoretical 20,000 years of possible. It's really evaluate for hurricanes and earthquakes, both types of major catastrophic coverage. Obviously, we're not too concerned about earthquakes here. The consideration is hurricanes, and you come up with a 100-year analysis. And in that analysis, the 100-year storm would cause an estimated $18.4 million in insured damages to Indian River County based on that analysis. So we looked at that, and staff thinks, since it provides a cost savings at this time, we think moving forward with a $25 million limit of coverage is beneficial. Also want to mention as a frame of reference, when Hurricanes Francis and Jean hit in 2004, those two storms combined, our insured losses were $6.1 million. So that's a good test of that $25 million limit. We saw some pretty damaging storms. Over two storms there was $6.1 million in insured losses. That puts in the context of $25 million of coverage. However, if the board, there is a risk involved there. If the board wanted to add the other $25 million, that's board can set that policy. But at this time, staff is recommending the $25 million limit as proposed. And I'll open up to any questions.
Questions, Commissioners?
Staff's recommendation.
Got a motion to approve staff recommendation. Second from Commissioner. The motion was made by Commissioner Wheeler. Second by Commissioner Fletcher. All those in favor signify by saying aye.
Aye.
All those opposed, nay. The motion passes unanimously. Next, we have the Public Works Department right-of-way acquisition, 66th Avenue, number 370.
Thank you, Mr. Chairman. Michael Zito, Assistant County Administrator. Before you today is a voluntary land acquisition in lieu of eminent domain. The parcel lies within the northern segment of the 66th Avenue Improvement Project and is located at 6855 66th Avenue. The property has served as the homestead of John Jackson Jr. since 1994. It is rectangular in shape with 132 feet of frontage along 66th Avenue and totals 1.75 acres. Now, the engineering necessity for the road widening project requires a take of 47 acres, 64% of which is encumbered by a Murphy reservation. The appraisers were instructed to ignore the Murphy reservation. Mr. Jackson is not willing to sever the property. The proposed right-of-way line is 10 feet from the existing carport structure, also described as a work shed area, and 70 feet from the house. The appraisal ordered by the county came in at $69,000 for the partial take and $380,000 for the whole take. The appraisal ordered by Mr. Jackson's attorney came in at $600,000 for the whole take. The conditional settlement offer before you today follows two settlement conferences, the first of which was terminated by the county after an offer of $465,000 on the whole take. The result is a proposal to purchase the entire property for $480,000 plus $14,190 to cover Mr. Jackson's attorney's fees. No attorney's fees were incurred to represent the county, as this acquisition is pursuant to Resolution 139, a voluntary acquisition, the time being mutually extended and therefore no mandatory referral to eminent domain counsel. Mr. Jackson would be granted extended possession of the property for 2 years. The remainder of the property would be sold to the county at fair market value upon completion of the road project. In today's dollars, the county's appraiser estimates the remainder of the property to be worth just over $300,000. Adding in appraisal fees, the total cost of this acquisition is $498,312, 96% of which will be realized by the parcel owner. Mr. Jackson is represented by David Holloway of the eminent domain law firm of Tileston, Simon, and Holloway. He is present. He estimates and anticipates a jury verdict just on the partial take, ranging between $350,000 and $650,000, with an additional $250,000 in fees and costs for both sides of the litigation. Attachment 1 in your backup shows Mr. Holloway's estimate. Any hesitation to approve this comes not in the result of the negotiation, but in the impact on our road widening program from a capital improvements element perspective. Chris Moore will now show a few slides to reveal the property in more detail.
Thanks, Mike. Again, for the record, my name is Chris Moore. I'm the Assistant Public Works Director for the county. As you can see on the aerial, the Jackson property is on the southwest corner, near the southwest corner of 69th Street and 66th Avenue. This shows the 1.75 acres that belong to Mr. Jackson. That's the area outlined in blue. If you look at a little closer view of an aerial, this is facing the Jackson property. The house is to the left there. This is looking from the east, looking towards the west, towards the Jackson homestead. 66th Avenue runs along the bottom of the aerial there. North is to the right, and 69th Street is just a little bit off the screen over to the right. The Jackson parcel is the rectangular 1.75 acres right there. It has about 130 feet of frontage along 66th Avenue. If you were to look at the existing edge of pavement of 66th Avenue where it stands today, the west edge of pavement of 66th Avenue, and look at where it's going to be in the future, that's that black dashed line. That's where the new edge of pavement of 66th Avenue will be once the roadway is widened. If you look at the existing right-of-way line, this is county-owned right-of-way today versus where it will be in the future. It obviously runs much closer to the carport, and that's the 10 feet from the carport that Mr. Zito spoke of earlier. So that's how much right-of-way we will need to the west towards the Jackson property in order to build 66th Avenue. This red rectangular area is the 0.473 acres. That's the minimum amount of right-of-way that we need in order to build 66th Avenue in the approved alignment. Looking at the construction sheet, this is a sheet from the construction plans, the 60% construction plans for 66th Avenue. The Jackson parcel is this rectangular parcel right about in the middle where the arrow is. 66th Avenue again runs along the bottom of the aerial. 69th Street along the right side, north it's to the right again. Directly in front of the Jackson parcel will be 2 lanes south, the new 2 southbound lanes of 66th Avenue, 3 northbound lanes on 66th Avenue, one of which is a left turn lane. As you approach northbound on 66, approaching 69th Street, there'll be a left turn lane. And then there'll be a landscape median in between the northbound and southbound directions. Now, if I block off that same red square that I had before, that's the 0.473 acres, the partial take that we would need from Mr. Jackson as a minimum in order to build the road. And you can see that the future roadway falls almost entirely within that partial take area, that 0.473 acres. To summarize, on the Jackson property, Mr. Jackson purchased the property as his homestead in 1994. It's 1.75 acres, zoned Ag A1. That's 1 unit per 5 acres density. He's got a 2,700 square foot, 3-bedroom, 3-bath home, including a carport, a detached guest house, and a pool cabana area. To summarize the right-of-way needs, there's a total, this parcel is located in the design section of 66th Avenue between 59th Street, from 59th Street 4 miles north to Barber Street. That whole 4-mile section is being designed as one project. We may not build it as one project, but it's going to be designed as one project. Mr. Jackson's parcel falls in that section. Now, when that 4-mile section reached 60%, we identified all the properties that would be impacted. There were 64 total right-of-way parcels. We've already acquired 3. Jackson would be the 4th, so there's still 60 remaining. So it's still in the very early stages of right-of-way acquisition on this design section. Again, for Jackson, we need a minimum of 0.473 acres. That's the partial take that we need to build the road, the 4-lane divided section of 66th Avenue. Of those 0.473 acres, of the partial take, 0.3 acres, about 64%, was a Murphy reservation. But as instructed by the board, we've been ignoring the Murphy reservations along 66th Avenue, and it was ignored in this case in the Jackson appraisal. The owner proposed the full acquisition. That came out in the mediation sessions. He didn't want to do a partial. He wanted the full acquisition. We looked at it, and as a full acquisition, we could use the full site as an alternative pond site if our planned pond site on the Sedwani property doesn't work out for some reason. That's not been acquired yet. Or we could sever the 0.473 acres and then resell the remainder. That's a good possibility. And again, the owner declined to negotiate on the partial acquisition approach. The summary of the appraisals: the county appraisal was done in September '08. It was done by Boyle and Drake. They're a local Vero Beach appraiser, MIA certified. The partial, the 0.473 acres, was estimated value of $69,000. the full value of the whole take would be $380,000. That's according to the county's appraiser. The owner's appraisal was done in January of this year by Jesse Collister, another MIA certified appraiser. They estimated the full take value as $600,000. The summary of the mediation, our first session was held early December of '08. Attendees at that meeting were the owner, Mr. Jackson, his attorney, David Holloway, Public Works staff, and the county attorney's staff. The final offer made by staff at that mediation session was $465,000 for the full take, plus a lease back was offered to Mr. Jackson whereby he could stay in his home until the road construction was about to commence on 66th Avenue. The owner, Mr. Jackson, declined that offer, and that first session ended at an impasse. We reconvened, had a second session on January 29th of this year. Same attendees, bumped the offer up to $480,000, offered a 2-year lease back, and through negotiations, a long negotiation session, we were able to reduce the attorney's fees down from $33,333 to $14,190. At that point, we reached a settlement. Mr. Jackson has signed this offer. The current settlement agreement is for $480,000 plus attorney and expert fees for the total cost of $498,312. And the good thing about this is that it puts 96.3% of the acquisition cost back in the local property owner's pocket. We also got an estimate, if we were to not approve the settlement agreement and the case were to go to court, we got an estimate of litigation costs from Mr. Jackson's attorney, Mr. Holloway, and he's claiming that basically our worst day in court would be the $696,000 for paying for just the partial take, and he's got a breakdown of the costs. And our best day in court, the best possible case for the county would be the $294,000 outcome that you see down at the bottom. That particular outcome, our best day, would put 23.4% of the acquisition cost back in Mr. Jackson's pocket. The alternatives that staff has brought forward for the board today is number one is to approve the agreement that was settled on in the mediation session for a total acquisition package of $498,312 plus lease back. Alternative number two is to reject the agreement and move forward to eminent domain. Staff's recommendation is that the board approve the agreement as presented, number one, for the total acquisition cost of $498,312 plus lease back.
Mr. Chairman, I move approval.
Got a motion from Commissioner Wheeler and a second from Commissioner Flesher. Any discussion?
Yeah, I have some questions. Chris or Mike, did we look at these two appraisals, and did they use similar comp sales, and how did we get so far apart between two appraisals? This should be a pretty basic appraisal. It's a 3-bedroom house, and so how can in today's market we can be $300,000 apart on these appraisals?
I can tell you they did not use similar comps, but it's very common to have a vast spread between county commissioned appraisals and eminent domain bar commission council appraisers value. It's very common. I often suggest that when you have a spread that's this vast, that one of the two appraisers has missed the mark, if not both. But it's very common. I'll let Mr. Holloway defend his client's appraisal, but that they did not use the same comps.
Okay. And then I guess two other things is one, Chris, can you go back to the close-up aerial of the property? And Mike, what was the distance now from where the right-of-way line would be to the house, not the carport?
Yeah, 70 feet.
Yeah, from the carport, that yellow line there, the proposed right-of-way line would be 10 feet from the edge of the carport. This is the carport right here, and 70 feet to the house structure. So it comes in, it cuts across his driveway and comes in fairly close to the carport, right along the front there.
But still 70 feet to the edge of the house?
That's correct.
Okay. And is that carport, was it permitted? It kind of looks much older than the house. Was it just an original storage shed there or something? Or I guess I'm asking how much value is in that carport, and if it's just a storage shed for the lawnmower, because I can see the vehicles are actually parked up near the house, which is where you would think, because you don't want to walk 70 feet from where you park your car to your house. So is that shed just being used for storage of the lawnmower and the tractor?
I'm not certain. I believe that is just a storage shed, which the yellow line cuts across right here. But we're not saying that necessarily that the carport has to be demolished. We're just saying that the right-of-way line, and again, that's not the edge of pavement. That's just the right-of-way line.
Right. Yeah, edge of pavement is the black line there, correct?
Exactly.
And how far is that to the?
The edge of pavement
at 40 feet, 30 feet?
It's about 35 feet from the edge of pavement of 66, the proposed edge of pavement of 66 to the carport. And again, along the north side of that, let me go to the next, along the very north side of the edge of pavement would be a 6-foot sidewalk also. So you would have the edge of pavement of 66th Avenue, then a curb and gutter section, which is about 1.5 feet, and then a 6-foot sidewalk. So you would still have plenty of room to maneuver. Actually, we're showing his new driveway over in this position to connect up with the driveway that goes to the back there. You'd still have room to maneuver in this area to use the carport if you desired.
Or, and again, I don't really think it's being used as a carport. If it's just a storage shed, I'd rather go with a partial take and then offer to build a new storage shed in the back of the property, because it doesn't look from those pictures that it's being used as a carport. It's being used as a storage shed. I just think we're paying an awful lot for little we need here. And then I guess the other thing is, if this does go forward, and I'm not really in favor of this one, is the $10,000 we're holding to secure the value. I don't think that's enough. I mean, if we're going to be looking to try to sell that property for $300,000, I don't know if $10,000 would be enough to fix something up if it is, degraded or what. So I'd like to see that withholding increased as well too. But I just don't like the whole idea of buying this whole parcel for what little we need for and 70 feet. I think is a very reasonable distance, and there's some trees there and some buffering. I just don't think we should be paying that much for what we need here.
Okay. Thank you, Commissioner. Any other questions, Commissioners?
I just have one request. There's the 2-year lease back, and I think the leases are perfectly appropriate for this, and it adds value. But I'd like to put the value in a monetary form. And my guess is, and this is purely a guess, that a house of the 3-bedroom, 3-bath house with a pool and all is probably worth $1,500 a month, which is just pulling something out of the air, but that's $36,000 of value that we're giving to the person. So just some, in the future, rough parameter of what value these leases are, because they certainly do help reduce the cash out, but I'd certainly want to get some idea of the benefit to the applicant.
And tax avoidance as well, so we will do that for you.
Thank you.
Yes. What I'm hearing is at least 2 commissioners want to go back to the drawing board on this, and I obviously disagree with it for several reasons. One, I think government in general has a very disadvantaged position when we try to take people's property, particularly their domicile, and I think that's as it should be. I think property rights are one of the most important things in the United States, and I think that when we go in and take somebody's property like this, as I said, we're at a disadvantage. I think the price is fair. I don't think it's as high as we paid for some other properties, and staff has spent a lot of time negotiating this. I think it's a reasonable price to pay. And to go back in and start this all over again and spend even at the minimum as much as $294,000 in legal fees, or even more than that, in a whole take, and I believe that there's a good chance that the county may pay more than this in the end, in legal fees and time and inconvenience, and also, not to mention the emotional stress and everything else on the owner of the property that's being displaced. I think we need to hold people in their domiciles in the highest possible respect we can and treat them accordingly. So,
Mr. Commissioner, if I was one of those two that you were referring to, nothing I said would...
No, I'm not saying how you're going to vote. I said the way it sounds like.
Then I just
you want
wanted
to go back and renegotiate.
No, I didn't say anything like that. My statement was a forward-looking statement saying that in the future, and I think that's how Mr. Zito undertook it, though in the future, I would like a monetary value given to something like a leaseback.
I'm sorry, I misunderstood.
And I think that that is appropriate, because it says $498,000 plus leaseback. What I would rather have is simply a total cost. I actually agree with everything that you said about a person's domicile and property rights, and I've been consistent with that over time. But I've also been consistent with trying to get a financial value to things when we're paying tax,
and
using taxpayers' dollars.
I misunderstood. I apologize.
Any other?
Chairman?
Yes.
And I agree that we need to move forward as quickly as possible. If we've worked to this to an agreeable factor, we're looking at 0.473 acres, and I wager to think that if this does go into the legal venue, that we will be paying a much higher premium. In addition, I wanted Mr. Zito to point out that although we only need the 0.73 acres, that by moving forward with the entire parcel, what we have is value in the hands of the taxpayer as well. There is a significant value in the property, and it will not go in the way of demolition. Is that correct?
That's correct, sir.
And has the value of that property been discussed at this point as far as the resaleability?
Well, the remainder value in the after condition following the completion of the road project is estimated by our appraiser to be $311,000 in today's dollars. And then, of course, we wouldn't market it until the conclusion, and it may be a different market. Hopefully, it's a better market.
And perhaps it will be. And this I don't necessarily want to purport that this might be a wash, but most certainly we will regain back most of the value that we're moving forward today to move this road project forward, and in all fairness and deference to the homeowner. And that's what we have to keep in mind. So I'll maintain my second as well.
Mr. Chairman, I have one more question.
Yes, Commissioner.
If in 2 years we haven't started construction of the road, is there an option to continue to lease this to the individual?
Yes, sir, in 1 year intervals.
Right, thank you.
We've got a motion on the floor to accept staff recommendation. It's been properly moved and seconded. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
All those opposed say nay.
Nay.
The motion passes 4-1 with Commissioner O'Brien dissenting. We're going to take a 15-minute break.
hours to Mondays and Tuesdays. Oh, we should have been done by now, Wesley.
We should have been done by now, but you got long-winded on
I did.
insurance, yes.
On the insurance.
On that insurance thing, the health clinic kind of stuff.
I know, I tried to stop it. Let's move on.
Yeah, and then I tried to do that, and then all of a sudden that just added fuel to the fire for everybody else. I guess they wanted to pull the other direction.
I agreed with Commissioner Baird.
I did too, and that's why I had to, allay his fears that we weren't going to take a motion. I think he was ready.
I would have stopped. I would have stopped Sexton before he got going and said, you know, we don't need to discuss all this now.
Yeah, just by the way, don't we own a hospital? Oh no, that was good. Ouch, that hurt right in the kisser there. That hurt. Yeah, I guess we may see that Monday. Get ready, Gary.
What's that?
That we already own a hospital, and I'm going to get into their clinic.
We don't own the hospital. Taxpayers do. And the River County Commission don't own the hospital. No, the taxpayers own the hospital. They got their own board elected. They're autonomous district. Yeah, but we have nothing to do with the hospital as a commission. No, but you know what? Like Solari said, and I agree with him, competition's good.
You can call me Bob. You know, it's informal.
Like Robert said.
Or Dr. Bob.
Like Robert.
Like Commissioner Bob said.
Robert M. Solari.
He don't like Robert.
You don't need the same thing, Robert?
No.
Okay, I want to get back to work.
No. Sure?
Yeah.
Meeting will come back to order. We left off on the Public Works under Departmental Matters 12I1. Now we'll start with the Utility Services, construction of 16-inch water main in conjunction with 16th Street pavement project from 66th Avenue to 74th Avenue. Got a motion from Commissioner Solari and a second from Commissioner Flesher. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
All those opposed, nay. Motion passes unanimously. All right, now that moves us into the county attorney matters. Mr. Collins.
Commissioners, my annual contract expires in 1 week. What I'm proposing to do is renew the contract on the same terms as last year. Everything is the same except the date extends an additional year.
Okay. Commissioners, any questions, comments? Yes.
Just, I had discussions about this with Mr. Collins, and one of the points he brought up was that at the end of this renewal in March of 2009, that Attorney Collins would be retiring at that point in time. And so I guess two things related to that. One, I just wanted to confirm with Will, he is still planning to retire. I guess it'd actually be March of 2010. I'm sorry, Will, I didn't mean to rush you there. March of 2010. Is that still your intent?
I'll be 62 at that time, which is normal retirement age in the state system, and it is my intent to retire.
Okay. And then going along that, Mr. Collins, you thought that it may take up to 5 or 6 months for the county to conduct a search for a replacement for the county attorney position?
If you chose to go to a statewide search or broader, it would take 5 or 6 months. That's what we've learned from past searches for either county administrator or county attorney. I think 5 is the short end, 6 is a little safer. That may change in light of the internet. There's a lot more communication between the legal community. You can get the word out faster now on the internet than you could through advertising, probably in monthly bar magazines, which are weekly bar magazines. They have lead schedules. So it might be able to be done quicker, but I think you should be thinking about replacement no later than August, probably.
Okay. Thank you, Mr. Collins.
Any questions? Any other questions, Commissioners?
I have a concern about the contract in Section 5 for additional benefits that I drew on where it said that the county attorney is included in the senior management service class in the Florida State retirement system, and that brings the attorney to a higher level of consideration for retirement, and deservedly so, as he's senior class management within the county. But then the next line, that where the county agrees to make annual contributions to a county-approved deferred compensation program designated by the attorney throughout the term of employment is equal to the maximum annual contribution allowed by law. And last year I did not approve this contract, and particularly this section, based on the fact that it was upped from a little over $20,000 to $33,000, and I believe that's a tremendous consideration. It's a very nice benefit for the attorney as an employee. However, that can represent one of the jobs that we're considering or maybe considering in the future as we look at this tight budget year. And $33,000 in additional contribution, I don't see us going forward and approving. But then again, that's my input. I believe that that $33,000 brings the compensation package for the attorney slightly over $200,000, which is a little less than 25% of the attorney's budget of $866,206. A budget which does carry a lion's share of outside counsel, but it most certainly last year, getting back to that $33,000, it was up last year, and it was actually increased due to the fact that Attorney Collins stated that he would be retiring within 3 years, and that $10,000 actually paled the reduction in the contract that was approved without my support last year.
Commissioner Whittle?
I just have trouble understanding the inconsistency in treating our attorney differently than we treat our administrator in that particular case.
Mr. Slurry?
I've gotten no comments this time.
I need a motion.
I'm going to go ahead in light of Mr. Collins' retirement in 1 year. I don't think it helps the county any to start any other different process at this time, so I'm going to move approval of the contract as written.
I'll second that. So any further discussion before we proceed to vote, Commissioners? Seeing none, all those in favor signify by saying aye.
Aye.
All those opposed say nay.
Nay.
The motion passes 3-2 with Commissioner Wheeler and Commissioner Flesher dissenting.
Thank you, Commissioners.
Thank you. Next, we have the Commissioner matters. Commissioner O'Brien.
Yes, thank you, Mr. Chairman. In your backup is, we've been talking about this a little bit through the chamber leadership meetings that we've had, and also the economic summit that Commissioner Solari organized. One of the areas identified was that our jobs grant program excuse me, is fairly low, and so there's been proposed increases to the jobs grant. These will be targeted to our targeted industries list, so they're going to be going towards the high quality jobs that we're all trying to attract here. It wouldn't apply to retail and restaurants, things like that. It would be our targeted industries list. These numbers will put us on a more competitive basis, and this is more of a long-term additional benefit we can offer to try to increase businesses either expanding or moving and relocating here. And Linda Gonzalez-Schlitt is here from the Economic Development Council. And Linda, would you like to add anything?
I would. As you know, the Economic Development Committee has been working all year on the rewrite of the comprehensive land use element for economic development, and this has also come up in that committee, and the committee, your committee, supports this change for a couple of different reasons. One is that we need it to be more competitive with our surrounding areas, and also it simplifies it, the language simplifies it, it makes it more user-friendly. We've had this in place for a number of years, but it has not really been used, and we think it's a little bit in the language and the complexity, and so this has also been streamlined. I'm also vice chairman of the Chamber of Commerce, and the rest of our contingent, Penny Chandler and Bill Curtis, are up at legislative session in Tallahassee. And so I would also like to give their support, as Commissioner O'Brien indicated. They have also been active and feel that this would be a good change in policy.
All right.
Ms. Leak, I did hear from many of your colleagues and was present at the meeting where this had begun to take action and a lot of great input, and I can appreciate the fact that this can be added to the cadre, the toolbox, and I want to thank you for forging forward as we're foraging for many avenues to increase the commerceability of our county. And with that, would most certainly make motion to approve.
Got a motion to approve, Commissioner?
Do you mind if I made the motion on my matters, Commissioner? I'd love to have your second, if you'd like to do that.
I'll yield to you. I'll give you your second.
Thank you. Mr. Chairman, I'd like to move that we adopt the proposed changes to the local jobs grant program.
Got a motion and a second. And now open for discussion. Yes, Commissioner Solari.
As part of this motion, Commissioner O'Brien, I'd like to consider the following, to ask that perhaps going back 2 or 3 years, to give some of the performance and costs so far, and then agree to monitor the performance and costs going forward, and just so we can see 2 things. One, if it is effective, which I hope it is, and 2, just what the cost of the county is. And then just, not part of your motion, but just consider after the chamber goes through their next set of meetings and comes out in May, if they recommend a different set of targeted industries, or if over time we think that even tightening up the targeted industries to something like that's similar to the life sciences accord that we agreed with last week, if we want to target it even, use it as a more pinpoint tool. That's all.
Yes, sir. And to that answer, Commissioner, the EDC they do have a proposed change to the targeted industries list, and I'll be glad to get you a copy of that so you can take a look at what they're proposing. They have not made a formal vote on it, and of course it would have to come to us for final action, but I'll be glad to get you that proposed change to the targeted industries list.
That would also be a comp plan change, wouldn't it, if I'm not mistaken?
Yes, because we're one of the few counties that do have a conservation or a economic development element in our comp plan. And I don't know, I think Bill Shute or Bob Keating would be able to get you the information on how many job grants we've paid out over the last couple of years. So I think we have that information. I'll make sure you get that as well. And certainly we'll monitor this going forward. Absolutely. Thank you.
Question.
Commissioner Wheeler.
Yeah, under the proposed program, the $3,000 per job paid over 3 years, that's $1,000 a year?
That's correct.
And if the job's eliminated, of course, that would cease.
Stop.
Correct.
Okay. Just wanted to be sure that was clear. Thank you.
Yeah, this was a lot of good work put forward by the EDC, and we certainly do appreciate all y'all's work in taking that. I've seen the level of that committee, probably starting back about 2 years ago, really jump up and increase intensity. And of course, we have commissioners that are liaisons to it. And Commissioner O'Brien, I appreciate you bringing this forward as the liaison to that committee. It's very important, the work that these committees do. And I really do think that the 5 things that we're looking at implementing are going to be some short-term, mid-term, and then long-term economic stimulus for this community, which we desperately need. So, so I'm not just pointing out just one single committee, commissioners. I think it's been everybody kind of coming forward and crafting that plan.
I'd just like to add, and also agree with everything you said, Wesley, but I'd like to, as one commissioner, say thank you to Commissioner O'Brien, and also Commissioner Solari just coming on board and grabbing hold of this. And I think both of the commissioners have been very straightforward and moving to improve this. And I appreciate the work and effort they both put in. I know they put a lot of time in.
Mm-hmm. Any further discussion or anything? We have a motion on the floor in a second, but I don't think we voted yet. Is that correct?
That's correct.
Okay. All those in favor signify by saying aye.
Aye.
All those opposed, nay. Motion passes unanimously.
Thank you.
All right. Thank you. Next, we have the adjournment. There is no special boards. Okay.
Would you like a different kind of ceremony today?
You know what? No, I'm going to finish it like I always do. If there's no further business to be transacted at this time, I now declare this meeting adjourned.